Number 1. Use Vicks Balm. Using Vicks Balm, for example Weber Rub, near nose and on forehead can relieve stuffy nose quickly. You just have to use small amount of Vicks Balm and massage it a bit. It can have a mild irritating effect for some people, but this is safe to use. Be careful while using and avoid putting it in mouth or in eyes. Number 2. Take a shower. Have you ever had a stuffy nose and found that you could breathe so much better after a hot shower? There's a good reason for that. The steam from a shower helps to thin out the mucus in your nose and reduce inflammation. Taking a hot shower can help your breathing return to normal, at least for a little while. You can get the same effect by breathing in steam from hot water in a sink. Here's how. Turn on the hot water in your bathroom sink. Once the temperature is right, place a towel over your head and put your head over the sink. Allow the steam to build and take in deep breaths. Be careful not to burn your face on the hot water or steam. Number 3. Use a humidifier. A humidifier provides a quick, easy way to reduce sinus pain and relieve a stuffy nose. The machine converts water to moisture that slowly fills the air, increasing the humidity in a room. Breathing in this moist air can soothe irritated tissues and swollen blood vessels in your nose and sinuses. Humidifiers also thin the mucus in your sinuses. This can help empty the fluids in your nose and return your breathing to normal. Put a humidifier in your room to ease the inflammation causing your congestion. Number 4. Stay hydrated. Keep the fluids flowing when your nose is stuffed up. Almost all liquids can keep you hydrated when you are sick, including water, sports drinks, and even juice. They help thin the mucus in your nasal passages, pushing the fluids out of your nose and decreasing the pressure in your sinuses. Less pressure means less inflammation and irritation. If your stuffy nose is accompanied by a sore throat, warm tea and soup will help ease the discomfort in your throat too. Number 5. Use a warm compress. A warm compress may help unclog a stuffy nose by opening the nasal passages from the outside. To make a warm compress, first soak a towel in the warm water. Squeeze the water out of the towel, fold it and place it over your nose and forehead. The warmth can provide comfort from any pain and help relieve the inflammation in the nostrils. Repeat this as often as necessary. Number 6. Use a saline spray. Take hydration one step further with saline, a saltwater solution. Using a nasal saline spray can increase the moisture in your nostrils. The spray helps thin the mucus in your nasal passages. This decreases the inflammation of your blood vessels and helps empty fluids from your nose. Numerous saline sprays are available over the counter. Some saline sprays also include decongestant medication. Talk to your doctor before you begin using saline sprays with decongestant. They may actually make your congestion worse if used for more than 3 days. They can also cause side effects when you use along with other medications. Number 7. Drain your sinuses. It's not the most glamorous task, but you can flush your clogged nostrils with a neti pot. A neti pot is a container designed to flush mucus and fluids out of your nasal passages. It is recommended using distilled or sterile water instead of tap water. Here's how to use a neti pot. Stand with your head over a sink. Place the spout of neti pot in one nostril. Tilt the neti pot until water enters your nasal passage. Once the water flows into your nostril, it will come out through your other nostril and empty into the sink. Do this for about 1 minute and then sweep the sides. Number 8. Try decongestants. A decongestant medication can help reduce swelling and ease pain associated with irritated nasal passages. Many decongestants are available without a doctor's prescription. They come in 2 forms, nasal spray and pill. Common decongestant nasal sprays include oxymetazoline and phenylephrine. Common decongestant pills include pseudoephedrine. Many of these medicines are kept behind the pharmacy counter, so you will need to get them from the pharmacist. Use all decongestants correctly and safely. You shouldn't take a decongestant for more than 3 days without a doctor's supervision. After 3 days, a nasal decongestant may actually make your congestion and stuffiness worse. Number 9. Take antihistamines or allergy medicine. You may want to take an antihistamine or allergy medicine if your stuffy nose is the result of an allergic reaction. Both types of medications can reduce swelling in your nasal passages, helping to unclog the stuffy nose. Combination medicines that contain both an antihistamine and a decongestant can relieve the sinus pressure and swelling caused by allergic reactions. Follow the instructions for these medications carefully. If you don't, you may make your condition worse. It should also be noted that antihistamines might make you drowsy. If you aren't sure how an antihistamine will affect you, don't take the medicines when you need to be active or productive.